Hi everyone, my name is Rebecca Taylor and today I am going to be showing you my 3D model of a synovial joint. As you can see, I created the knee joint, also known as the tibiofemoral joint or the patellofemoral joint. In this joint, I included the bones, ligaments, capsules, and menisci, as well as anatomical markings. Let's get started on the video so you can see what I did over the progression of 5 days. This is day 1 of the progress that I've made so far in creating my right knee joint. So today I formed all of the bones out of clay and I created the femur, the tibia, the fibula, and the patella. Now the fibula and the patella aren't attached yet because I'm going to hot glue them on at a later time, but you can just imagine that the fibula would fit on the lateral side of the tibia and the patella would go right on the anterior part of the femur. Now, also today what I was able to do is make it so that my bones were fully movable and my joint was fully movable. So in between my femur and tibia, I used zip ties in order to give it that full range of motion so that it could have that range of motion that the knee would have, just like a hinge joint. This is the progress that I've made so far for day 2 of my synovial joint of the right knee. As you can see, what I've done so far is I've created the anatomical land markings on the bones out of colored clay. Obviously, these land markings are not these colors in the human body, but I've just done it to give you guys a representation of where they would be located on the bones. I've also created a legend here with the corresponding colors on the bones, as well as the name in order for you to follow along. If we start from the anterior view at the femur, we have the epicondyles, which is the medial epicondyle and the lateral epicondyle. Now medial just means that it is closer to the center of the body, and lateral means that it is farther away from the center of the body. As we move down to the tibia, we have epicondyles as well. Once again, the medial epicondyle and the lateral epicondyle. This purple shape right in the middle is the tibial tuberosity, and then this blue line, which would be all along this crest, is called the tibial crest. As we flip this form over onto the posterior view, we have the condyles of the femur, and remember, as we flip this over, this would no longer be medial and lateral, but this is now the medial condyle and this is the lateral condyle. This is the progress that I've made so far in day 3. What I was able to do today was attach the fibula to the tibia, and at first I tried using hot glue, but the hot glue wasn't susceptible to the clay, so instead I used a toothpick and attached the two straight through here in the middle. Also, what I was able to do today was attach the tendons and ligaments. So first, as you know, I had the zip ties going parallel to each other originally, and now what I've done is I've changed them so that they cross over each other, so that this one right here is the anterior cruciate, and when we flip it over onto the posterior view, we'll be able to see the posterior cruciate, but it is this one to the left of the anterior cruciate. Also, I was able to add on the fibular collateral ligament as well as the tibial collateral ligament. So the fibular collateral ligament connects the femur to the fibula, which is this ligament right here with the blue elastic band, and the tibial collateral ligament connects the femur to the tibia with this elastic band here. And this just allows the kneecap to be supported and not to move back and forth, which is one of the reasons why it has a hinge joint. Now, as we flip this onto the posterior view, you can see the posterior cruciate is in there. It's a bit difficult to see, but it is in there, as well as the meniscofemoral ligament, which is this light brown elastic here that connects on the back of the femur. Also is the meniscus, so if we flip back over to the anterior view, we have the medial meniscus as well as the lateral meniscus. And I didn't do a very great representation of this. What should really be happening is these two should be resting on top of the meniscus. This is the progress that I've made so far in day 4. What I was able to do today was attach the ligaments and tendons surrounding the patella. So the first one is the patellar ligament, which I used a green elastic band to show, and it attaches from the tibia to the patella. Then I was also able to attach the patella. Once again, hot glue was not on my side today, but I was able to make it work. Also, these two yellow elastic bands surrounding the joint are the patellar retinaculae. And then I also attached the quadriceps tendon, which is this pink elastic band. After the quadriceps tendon, if you
go superiorly, you would run into the quadriceps muscles, but I didn't show that in this diagram.
Now, finally, it's day 5 and I can give you the final reveal. So this is the final knee joint that I have prepared, which is fully functioning and fully movable. First, we start off with the anterior view. Then we move on to the medial view. Then the posterior view, and I apologize, my client has osteoporosis, so his bones are a little fragile. And lastly, we move on to the lateral view. I hope that you enjoyed this video and learned a little bit more about the knee joint.